Abby Brader,
My name is Maggie Winslow.
and today we are going to inform you about ectoderma pigmentosum. What is ectoderma pigmentosum? Ectoderma pigmentosum is an inherited gene that you get from your parents, and it's when a person is sensitive to ultraviolet light, otherwise known as the sun. It can affect the eyes and skin that is exposed to the sun. In some cases, it can also affect the nervous system too.
What happens to people with this disorder? These people often experience premature aging. There's an increased risk of sunlight induced cancers. Some people can develop a severe sunburn after just a few minutes exposed in the sun. You can start to develop freckles in exposed areas around your lips, face, and arms, but it usually does not occur in young children. It can also cause dry skin and pigmentation. It can also have neurological effects like loss of hearing, walking, and difficulty speaking. A day in the life with XP. When leaving the house, you always have to wear sunscreen and have protective clothing on, like hats and gloves. You'll need to check your indoor environments with a UV meter to identify dangerous sources of exposure. You might have to get blinds and special windows where the sun doesn't go through. You might also need to swap light bulbs. People with this disorder can go outside and do things, they just have to be very protected and ready for whatsoever.
How to diagnose XP? First, if the doctor or guardian starts to see signs, then you want to take them in to get tested. Second, the doctor will take a blood test and send it in. After that, they can see if that person has the DNA mutation to have XP. Normally, it is diagnosed around the age of 1 or 2 years old.
How many cases are there? There are about 1 in 1 million people who have XP. The condition is actually more common in Japan, North Africa, and the Middle East.
5 facts about XP. 1. The gene is very rare to pass on to your kid. 2. About half of the people diagnosed with XP die from skin cancer each year. 3. If you're thinking about having kids, gene counseling is something you should think about if XP runs in both of your sides of the family. 4. With XP, you can have patchy and thin skin. And 5. Under your skin, you can get spider-like blood vessels.
Who does this affect? This disease can affect both males and females equally. Some gene mutations with XP are more common in certain parts of the world, but there's a higher prevalence on XP.
How do people get XP? So XP is an inherited gene that gets mutated during the combining of traits. Since it is a recessive gene, both of the parents need to carry it. They call this autosomal recessive. The mutation tends to happen in the 13th chromosome, and both pairs of the chromosomes are affected.
Symptoms. Symptoms with XP is that you're easily affected by the sun and your sunburn does not heal. Patches of discolored skin that doesn't heal and gets worse, resembling severe aging, crusting of the skin, scaling and oozing of the skin, spider-like vessels under the skin, and blistering after little sun exposure.
Prognosis. There's a greater chance of people with this disease to get skin cancer than people without this condition. Also, it is stated that people with this disease will live a shorter life. Normally, it is around your late 30s if you treat your disease. If you don't, your lifespan might get shorter and shorter.
Treatment options: avoidance of the sun and sun protection, chemo prevention of skin cancers, and other treatments like chemical peeling, treatment of actinic keratosis, treatment of skin cancers, investigation therapies, and neurological management. Thank you for listening.
And if you are interested in donating, please donate to the Ectoderma Pigmentosum Support Group.
We hope you like our presentation.